Hello everyone, I am Go a plastic surgeon in Korea. Today, let's talk about the brow lift. The drooping of the upper face is mainly expressed by the drooping of the eyebrow and the upper eyelid. And the drooping of the eyebrow and upper eyelid reduces the double eyelid, hides the eye, makes the wrinkles around the eyes deep. Many people are trying to solve their upper eyelid drooping with the skin-excision double eyelid surgery. This is a very wrong idea. Because Westerns have thin skin, even if we remove a lot of skin from their eyes can look natural. But because Asians have thick skin, removing a lot of skin creates a very unnatural double eyelid. Let's look at this picture. The skin of the upper eyelid is getting thicker from the bottom to the top. Therefore, if we cut out a lot of skin and make double eyelid, the lower thin skin and the upper thick skin meet. So, when opening the eyes, a thick, unnatural double eyelid must be made. This is the result. So, Asian people with a drooping eyebrow and upper eyelid shouldn't have a double eyelid surgery with a cutting off a lot of skin. They must have forehead lift or brow lift to improve the upper eyelid drooping earlier. Brow lift is an operation to cut out the skin just below the eyebrow and lift the skin of the upper eyelid. And through this operation, the sagging upper eyelid can be improved. And at the same time, the wrinkles around the eyes can be improved. As for Westerns, we use a simple method to cut out the skin just above the eyebrow and lift it up and suture the skin. Westerns can have this simple procedure because their skin is thin and white. The scar cannot be seen. However, for Asians, we should not make incisions on the skin just above the eyebrow because the scar can be seen. For Asians, we perform the brow lift as follows. We cut off the skin just below the eyebrow. Dissect the tissues below the skin sufficiently upward from the incision site. Lift up the skin of the upper eyelid. Fix the subcutaneous tissue of the upper eyelid on the muscles under the eyebrow and suture the skin. The swelling will develop after the operation, but it should disappear after 5 to 7 days. We remove the stitches on the 10th day after surgery. The scar looks like a red line until 1 month after surgery. After that, it's getting blurred and rarely appears 3 months after surgery. Therefore, the final results can be seen about 3 months after surgery. Those are before and after pictures of the brow lift. If you compare two pictures, the drooping of the upper eyelid was improved. So, the existing double eyelids can be seen, and the wrinkles around the eyes were improved. If you want to change the shape or size of your eyelid, you should improve the drooping of your upper eyelid through brow lift before. By this way, you can get very natural double eyelid because you don't need to cut out the eyelid skin, or even if you need to cut, you only have to cut a very little amount. I fishing out today. What you have to remember from today's story is that if you have an upper eyelid sagging, you should not have double eyelid surgery, which cut out the skin as much as it droops, before improving your upper eyelid sagging. Well, I'll see you next time. Bye. There are two reasons why I am making these videos. The first is to introduce you to cosmetic surgery easily, interestingly, and honestly. The second is to give you preoperative counseling and evaluate your post-operative results. First, introduce cosmetic surgery easily, interestingly, and honestly. There are so many different treatments and procedures for cosmetic surgery that many people, including you, do not know much or misunderstand about cosmetic surgery. Even counselors who work at cosmetic clinics do not know or misunderstand about it. So I try to help you understand cosmetic surgery easily and make the right choice. I also want to introduce my thoughts on cosmetic surgery and surgery that I do a lot. Second, preoperative counseling and evaluation of post-operative results. To get a satisfactory surgical result, 1. You must have a good understanding of your physical condition. 2. You have to know what operation is appropriate for you. 3. You should understand how much change you can get through surgery. You may not know or misunderstand these three things, so it is best to discuss them in person with an expert like me. If you had the operation, you must expect good results. But you will worry about whether you are recovering well or not. And you will wondering when you will recover completely and final results will come out. If you have unsatisfactory results or have problems after the operation, you must want to know when and how to improve. In both cases, the person you need most is an expert who has no relation with your surgery and can honestly advise you. I'm going to give you that kind of help.